I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakana. I'm also one of the co-founders. And I want to welcome all of our business partners and all of our guests to our virtual Doctor's Edition. Every Tuesday evening, we really try to break down the difference between CBD and medical marijuana and some things that our patients are coming and asking us about as it relates to CBD. And Dr. Joy just joined. Welcome, welcome.
Good evening.
So, yes, and Dr. Joy, you have a guest on the line. Ida Lewis
Yes.
is on the line. So excited that we have healthcare professionals joining. And just a little bit about myself. I'm an obstetrician gynecologist of over 30 years. I trained at Wayne State School of Medicine. I did my residency at Cook County, where Dr. Joy Smith is a lead pharmacist. It's now called Stroger Hospital. I'm also CEO of RJM Wellness and Rip Rita Fitness. I'm a global speaker on women's health and fitness. I'm also a certifying physician here in the state of Illinois for the medical marijuana program, as well as the opioid exchange program. I'm a member of the Doctors for Cannabis Regulation, and again, Chief Medical Officer and co-founder for Wakana for Life. So I want to welcome all of you. And how did I get started in the cannabis industry? Well, 3 years ago or 4 years ago now, time is flying. I was introduced to CBD. I was introduced to CBD by our CEO of Wakana, and I didn't know anything about CBD. I didn't know that there was a part of the plant that actually had medicinal properties and was able to provide relief for my patients without the high. And I was amazed. I had never, ever really understood the importance of the hemp species of the cannabis plant. We're going to talk about how important that species is. But long story short, I've been using CBD in my practice for the last 4 years. I've been using CBD personally, as well as professionally, as well as with my family and friends. So that's how I got started. It's important because so many of our patients now more than ever during this global pandemic are absolutely looking for a organic, holistic option for their health. You know, this is what we run into many times. Many of our patients are on multiple medications. You know, the average 50-year-old is on about 7 medications. The average 70-year-old is about on 12 medications. And we understand as healthcare professionals, when we deal with our patients and they're on this many medications, we see side effects. We see side effects that lead to the addition of more medications. So we want to really help our patients have options. We want to help our patients to reduce the amount of medications so that they can reduce the side effects. So what happens when most patients come to us and say, Doc, I want to use CBD? They get a thumbs down, right? They get a thumbs down from us because we weren't taught anything in medical school about cannabis. It's estimated that less than 5% of medical schools today even mention cannabis and its role in helping to produce homeostasis or balance in our body. And that's how cannabis works. It works through a science, and we're going to talk about that science called the endocannabinoid system. So let's look at the plant. Let's look at the cannabis plant. The cannabis plant has 2 species. One species is called marijuana. Many of us have heard of marijuana. Marijuana is a species that gives our patients that high, the euphoria, the paranoia, the munchies. See, the marijuana species has a high level of a cannabinoid called delta-9. Delta-9, that is tetrahydrocannabinol, is another scientific name for THC, but it has high levels of THC, very small levels of CBD, So it's the marijuana that, yes, it has medicinal properties, but it gives our patients that high. It also shows up in their urine drug screen. And that really prohibits a lot of patients from getting a medical marijuana card. And then we have the hemp species. This is the species that has high levels of CBD or cannabidiol that we'll speak about tonight, and very trace amounts of THC. See, by definition, hemp is defined as having 0.3% or less of THC. So now we have a species that we can offer our patients that gives them the medicinal benefits they're looking for, medicinal benefits in reducing pain, anxiety, inflammation, addressing their sleep, their insomnia, addressing symptoms due to their lupus or their fibromyalgia without them having a high, without them having a euphoria or a paranoia or even the munchies. So that is the hemp species. So that's the difference between hemp and marijuana. And this is the difference that many patients are looking for. They're looking for an opportunity to use this plant and not have that high. So another reason why physicians are a little hesitant, many traditional physicians like myself that were trained in allopathic medicine, where there was no herbal or functional or integrative medicine introduced, are side effects. You know, how does CBD interact with other drugs? And we're going to talk about that, because CBD can inhibit a medication that a patient's on or potentiate the medication that they're on. And it does that because CBD, cannabis, is metabolized through the liver. We're going to talk about that CYP450 pathway. Another hesitancy is, does CBD show up in a drug test? You know, I think it's important that as physicians that we are equipped to answer these questions for our patients. We're going to talk about that as well. Does CBD show up in a drug test? So CBD, yes, is the rage among patients. More and more of my colleagues are coming to me and asking questions, or they're actually referring their patients to me because they don't know enough about CBD. But patients, they've done their due diligence. They've done their research. So they understand that it's an option for their health. Another reason that CBD and cannabis as a whole has become mainstream, it's because our colleague, Dr. Sanjay Gupta, made a public apology in 2013, 2014. He said that we've been systematically misled about this plant. He said we didn't dig deep enough, he didn't dig deep enough. He didn't dig far enough in the research in really learning that this plant has been used medicinally since 2737 BC. This is nothing new. In fact, pharmaceutical companies like Pfizer and Eli Lilly and Park Davis, all of these pharmaceutical companies that we know today and we use today were using cannabis-based medicine for over 60 years prior to prohibition, prior to the 1930s. So Dr. Sanjay Gupta really has led us as healthcare professionals to be more relaxed and to be more open about learning about this plant. Another thing that you should know is that the FDA has approved a prescription drug called Epidiolex. It is the first and only CBD FDA approved prescription. It is a drug that's used for Lennox-Gastaut syndrome or Dravet syndrome. Dravet syndrome is a syndrome that causes children to have between 300 to 500 seizures a week. In fact, Dr. Sanjay Gupta met that little girl, Charlotte Fiji, who had Dravet syndrome, and nothing worked for her until her parents introduced her to CBD. So just know that this is a product that the pharmaceutical companies have engineered and altered into a approved medication. So again, we're going to talk about CBD. We're going to talk about CBD that comes from the hemp species, because this is a product that we can feel comfortable recommending to our patients. A product that does not need a certification, like a medical marijuana card, doesn't need a prescription, like an opioid, but just needs a physician, a doctor, a nurse, a dentist, a chiropractor, whatever healthcare profession, a pharmacist that feels comfortable about this knowledge. So let's talk about cannabinoids. See, the cannabis plant has been identified to produce over 180 compounds called cannabinoids. Well, these are the main players. These are the ones you should know about. But not only that, it's CBD that has the medicinal benefits out of all of these cannabinoids. See, CBD has been shown in research and data. In fact, there's over 20,000 peer-reviewed articles that you can search your favorite search engine and look at all of the data to be an antibacterial. It inhibits cancer cell growth. There's data that shows how CBD can reduce the risk of cancer cells metastasizing. CBD is neuroprotective in helping patients who have had strokes, helping patients who have had nerve damage due to trauma, helping those patients that have neuropathy or sciatica. CBD also promotes bone growth. It reduces seizures and convulsions. We talked about the little girl that had Dravet syndrome. It reduces blood sugar levels, so helping to normalize those who have type 1 and type 2 diabetes. CBD also reduces the function of the immune system. That's key when we're speaking about those autoimmune diseases like lupus and fibromyalgia. The list goes on and on. Reduces nausea and vomiting, reduces anxiety, is a vasorelaxant, helps to treat psoriasis and eczema and acne. It is also joined by other cannabinoids that also have medicinal properties like CBG and CBC and Delta-9 THC and Delta-8 THC. All of these cannabinoids synergistically come together on a cellular level and really help to promote homeostasis or balance in our patients who are looking for a reduction in pain or a reduction in anxiety or a reduction in inflammation. And how does it do that? How do these compounds work in the body? Well, there is a science. The science is called the human endocannabinoid system. This is a system that is deemed one of the most vital regulatory systems in our body. It was discovered in the early 1990s when I was at Wayne State School of Medicine. I was not taught about the endocannabinoid system. In fact, we talked about less than 5% of medical schools are teaching this science, but it's key to understanding how CBD, how the other cannabinoids, how even cannabis as a whole works in the body. The way it does that is that we have receptors. We have receptors in our brain, our central nervous system, our immune system, our periphery. We have receptors, as you can see in this chart, throughout our entire body. Every organ and gland has receptors, either CB1 or CB2 receptors, that when you consume CBD or other cannabinoids, they bind to these receptors and send a signal to the area that needs help. This system puts our body in homeostasis. This system puts our bodies in balance. So let's look at that another way. Well, first, let's talk about how our body can produce cannabinoids just like the plant does. The plant produces phytocannabinoids, but guess what? Our bodies endogenously produce cannabinoids as well. Two of the main cannabinoids that our body produces is one, anandamide. It's the cannabinoid of bliss. In fact, it's found in breast milk. So our breastfed babies are receiving cannabinoids. And then 2-AG. 2-AG is another endocannabinoid that our body produces that addresses inflammation, that addresses pain. See, anandamide is analogous to THC, and 2-AG is more analogous to CBD. So you've got one that gives you the bliss and one that takes care of the inflammation in the body. So what happens is, that slide is out of order. What happens is when we consume a CBD, they bind to receptors in the postsynaptic neuron. They send a transmission or a neural transmission to the presynaptic neuron and then out to the body, either out to the immune system or out to the brain or central nervous system that's regulating and modulating pain. So this is the science behind how CBD and other cannabinoids work. So again, what's fascinating is that when you look at the literature and you dig deep in the literature and you dig deep 5,000 years from today on, in the past, there's not been one death from cannabis. Not one person has died from consuming cannabis. So the reason being is that the part of the brain that modulates and regulates the respiratory center is not a receptor that is found in the brain for cannabis. Those receptors in the respiratory centers, the medullary part of the brain, has receptors that identify opioids. That's why when you take too many opioids, you can overdose and die. But you cannot consume too much cannabis and die. So it's important to understand that we're speaking about cannabis that's regulated. We're not talking about that cannabis that can be found on the streets. Yes, you probably could die from consuming too much of that because many of those products are tainted with rat poison and fentanyl and other very dangerous things. But just know that no one has ever died from consuming much cannabis. The most that happens is that they will get very sleepy and get the munchies. So this is another schematic diagram that shows the receptors binding. And once they bind to those receptors, the cannabinoids bind to those receptors throughout the entire body. They send a signal either to the immune system, to the central nervous system, wherever homeostasis or balance is needed. The research, when you're looking for cannabis and CBD research, PubMed is a good source. There's lots and lots of studies that you can find as it relates to PTSD with veterans. Lots of studies that you can find that talk about cannabis being used for those who are receiving cancer treatments, to helping with their nausea and vomiting, and even their appetite. There's also a lot of cannabinoid studies that are done as it relates to anxiety. You know, we're seeing a lot of anxiety in our patients during this global pandemic. Studies that we are using cannabinoids in the management of really difficult to treat pain, that long-term chronic neuropathy or long-term chronic osteoarthritis and even rheumatoid arthritis. So hopefully now that you have heard this information about the hemp portion of the cannabis plant and how the cannabinoids work in our body and the endocannabinoid system, and how important it is for our patients that are looking for a holistic, organic way of addressing their health, it's important that we understand how these products work. There is one more slide that I want to share that was, let me find this slide real quick, because I think it's important that you understand that there are different ways of consuming cannabis. And I want to show you that slide right quick here. Let's see. So there's different ways of consuming cannabis, CBD products. One way is through oral application through tinctures. Another very popular way are edibles, gummies, Capsules are a possibility. Liquids, they're water-soluble products that your patients can add in their food, their liquids or juices. And then there's vapors. There are ways that you can smoke CBD either through a cartridge, a vape cartridge, or through a smokable product, or even fresh CBD flower. And then another very, very popular way is topicals. Patients love using topicals to offer local relief. When we use topicals, what's interesting is that topicals do not pass the blood-brain barrier. So topicals, when we're speaking of a full spectrum product that has the legal limit of THC 0.3% or less, they do not pass a blood-brain barrier. So this is important because there are many patients that are still undergoing random drug screens. So there are broad spectrum products that they can use. There are products that contain less than 0.0% or less of THC. There's topical products that they can use very safely without having to fail a drug screen. So I wanted to add that slide to show you the different ways to consume CBD. So now I'm going to bring up my colleague, Dr. Joy Smith. Dr. Joy Smith is a pharmacist, lead pharmacist at Stroger Hospital. She's my business partner. She is a wife. She is a mom of a beautiful 5-year-old Ayana, and I want to bring her up now to present our next part.
Sorry, I was on mute. Hello, everyone. How are you? I am Dr. Joy Smith, as Dr. Rita stated, and I am a pharmacist. I'm a proud Wakanapreneur, Ruby dispensary owner at Wakana, to be exact. And I've been out of school now for about 8 years. Went to Florida A&M University and got my, it'll be 9 years this year. Went to Florida A&M University and got my doctorate in pharmacy. Been an outpatient, as she stated, at John Stroger Hospital or Cook County Hospital, and in a variety of settings, outpatient, inpatient, been in some ambulatory clinics, and I started in retail. So when I first started my pharmacy career, shortly after my brother got diagnosed with cancer, and he's fine now, thank God, but that really sparked some change in us because he really changed around his diet. He changed the way that he was living and what healing looked like for him. He really reframed that. And so as he went on his wellness journey, it inspired a lot of us to go on our same wellness journeys. And my wellness journey led me to health coaching. It led me to becoming a certified aromatherapist. And then Wakana found me, and I was introduced to Dr. Rita, and we've been pretty much joined at the hip ever since. Dr. Rita and our 4 co-founders have so much knowledge in this cannabis space. And me as a healthcare professional, it was just so intriguing to me how a plant that's been so stigmatized for so long had so many health benefits that, one, I wasn't willing to learn about at first because I just knew that it would compromise my license. That's what I thought I knew. And then two, it had just been stigmatized for so long that I thought that it was going to be damaging to my career or that I would be a proponent of something that could hurt my community. But I was so wrong. So getting into our presentation this evening, why do people seek CBD? Dr. Rita has given you an amazing overview about CBD and also reasons that people seek it. And pain, anxiety, and depression are high up on the list, as well as insomnia. So when we're talking about why people are using CBD, we're talking about chronic pain. It's the #1 cause of disability and disease burden globally, as you see here. Anxiety disorders. There are so many people suffering from anxiety, not just because of COVID, but even before COVID, there was anxiety for many reasons. In fact, 18.1% of the population every year over 18 is suffering from some type of anxiety disorder. And then 6.7% of adults have had at least one major depressive episode in a given year. So we're really dealing with a lot of mental health issues that are coming as a result of our environment, and it's just plaguing the nation. So when we're talking about the prevalence of depression symptoms, let's just talk about before and after COVID. This is from the Journal of American Medical Association. I thought that this quote was interesting, that the prevalence of depression symptoms in the US was more than 3-fold higher during COVID-19 compared with before. So individuals like the people that I work with a lower socioeconomic status, with lower economic resources, greater exposure to stressors, excuse me. I think that's almost everybody, whether you have low economic resources or not. We're dealing with e-learning. We're dealing with people who have lost their jobs, who might have had really great jobs, dealing with people who are having a number of health conditions, not only with themselves, but with their families. There's a greater burden of depression symptoms there. So a lot of people are experiencing a lot of mental health strain that they have not experienced before. So with all of the mental health strain, I'll go back to this one, with all of the mental health strain that people are experiencing, with all the pain that people are experiencing, all of the other health conditions, you know, you may be wondering what other alternatives there are. As healthcare professionals, we are trained to provide prescription medications. Some of us have gone over to the holistic side and have been able to prescribe holistic options as well as traditional options. But if you're not on that side yet, you may wonder how those holistic options interact with drugs that your patients are already taking. So the big question is, are there any drug-drug interactions between CBD and prescription medications? And the answer, in order to get that answer, we're going to review a little bit about what we know about the CYP450 enzymes. So these are 6 of the major CYP450 enzymes. I'm sure you recognize them, our healthcare professionals out there, but they metabolize over 90% of the drugs that our patients are taking, right? So they not only play a role in the pharmacokinetics of prescription medications, but they also work to metabolize CBD. So what you may or may not know about CBD is that it's a substrate of 2C19 and 3A4. So those are assigned to break CBD down. Now, if CBD is traveling along those 2C19 and 3A4 pathways, and there happens to be another medication coming down that same pathway at the same time, of course, we know what's going to happen. It's going to interact with our medications. But what we know about medications that our patients are taking is that when the risk outweighs the benefit to take both, you make sure that you space them out. Just like we would space out any medication that interacts, you space out CBD and any traditional medication from each other, excuse me, so that they won't interact and be traveling down the same metabolic pathway at the same time. I don't want us as healthcare professionals to be so scared and to shy away from trying an organic and holistic option that can really help to improve a patient's condition, that can really help to address the symptoms, and that really has science to back why this component of the cannabis plant is really going to affect change in communities and in people. So what we also know about CBD is that it inhibits certain enzymatic pathways. So if you are prescribing certain medications that follow these pathways as well, the spacing rule still applies. Just because this is these are the facts, does not mean that there's not a way to incorporate CBD safely in your patients. So when we look at medications that might interact with CBD and fall down these pathways, I just mentioned medications that are common in the populations that I serve. So when we're talking about high cholesterol, the hypertension, heart complications, being patients with anticoagulation, I was in that clinic for a long time, and there are a lot of interactions, especially if the patients are on warfarin. Whether it's asthma and allergies, diabetes, NSAIDs, pain medications, there are a lot of actions that botanical medications or plant-based medications can have that can mimic some of the actions of our traditional medications. So spacing them out, allowing the CBD or any other holistic option to be able to come in and address those symptoms is something that can really improve the quality of life, especially if patients are concerned about the symptoms that they're experiencing. I mean, I fill medications, including narcotics, on a daily basis. And when we're filling for instance, lorazepam, that is designed to help with the anxiety or depressive symptoms, the anxiety that comes as a result of depressive symptoms, but it still has the ability to increase depression. For me, that doesn't make sense, because we're sending the patient in this hamster wheel. Do I think that medications can be life-saving? Absolutely. Do I think that there are patients and people in our medical community that need medication in order to survive? Absolutely. But if there is an opportunity for a patient to have a choice, if there's an opportunity where we can employ some natural holistic options that the body is used to breaking down, I think that every healthcare professional should give that a shot and just understand that there are studies. There's an endocannabinoid system inside of all of our bodies that is looking for this cannabis and looking for plant-based options to bring our body back in balance. So you may say, as a healthcare professional, why should I care? Like, who's using alternative medicine? I was taught to prescribe this medication for this ailment. Why do I need to just change this up now? So this graphic here in treatment trends talks about from 2014 to a time frame of about 2025, what's being used. And we're talking about botanicals. We're talking about alternative treatments like acupuncture, yoga, mind and body treatments, and other modalities that are considered complementary or alternative medicine. And as you see, from 2014 to 2025, there's really an increase in the use of botanicals or plants that have been found to have medicinal benefit. So as we see this increasing, we're seeing that the interest in botanicals is greatly growing among people who are using them. And that brings me to essential oils. I told you all that I was an aromatherapist as well. I'm just really fascinated by how plants can come in and affect change in people's lives and just have some of the same actions as some of the treatments that we use on a daily basis. So essential oils are highly concentrated aromatic extracts that are distilled from a variety of plant material or expressed from flowers to grasses, leaves, roots, seeds. It can relieve pain. It can reduce stress. It can improve the mood. And I'll talk about how it can improve the mood in a couple slides from now, but there are so many applications, just like there are applications for CBD to really affect anxiety, pain, depressive symptoms, bone growth, just so many options. Essential oils have some of those same actions as well. So you may be wondering, what is this weird slide, right? So when we're talking about essential oils and when we're talking about plant-based options, it's really important to me to let people know that these are not new. Plants and plant-based healing has been around for so long, and this is just an example of it. So this is what a doctor would look like back in like the 1413 in Europe. And so this particular doctor was one that was clad in these robes because of the bubonic plague. And so what happened, there are particular oils that were put into the robes and put into what looks like the beak, but is a mask for those doctors so that they wouldn't contract the plague that they were around when they were treating patients. And one of the important stories I like to tell is about how this particular blend, often called Thieves Oil, came about. And the way that this came about is that there were perfume and spice merchants who were stealing from the graves of the people that were dying from the bubonic plague. And when they got caught, the judge was like, well, hey, how are you able to steal from these people and not get sick? I mean, everywhere you went, just like it seems like with COVID, it seems like everybody's just contracting it. Everywhere they went, there was someone with the plague and people were dying. So they said, if you give us your method and how this didn't happen, we'll let you go free. So they said, we were perfume and spice merchants. We know how to put together blends and different things that are going to keep us safe from viruses, keep us safe from sickness. And so cinnamon, rosemary, clove, lemon, and eucalyptus was the blend that they used to douse themselves so that when they did go steal from the graves or they did go steal from the homes of those who had died, they weren't going to contract the plague. And so even though that was not a great way to protect themselves because they were thieves, I mean, you don't want to protect yourself from a thief, but even though they were thieves, the concept still stands that essential oils in general, plant-based options do have the power to heal. It's not just woo-woo science, it's really true. And there are studies to show that. So when we're talking about how essential oils actually work, when we're talking about when you inhale them, what happens in your body, I wanted to use this graphic specifically about the limbic system. So when the receptors in our nose send messages to that olfactory bulb and they go into the nasal cavity, it's in charge of emotion. It gets to the limbic system, which is the emotional part of the brain. So that's why an aroma or a fragrance can trigger memories. They can trigger particular moods. They can go to the hippocampus and the amygdala and just control all of those different areas. And so once our body releases chemicals after those things happen and after that aroma gets to the limbic system of the brain, it tells our body what to do. It tells our body whether we want to feel calm, relaxed, energized, uplifted. And that's only what happens when we inhale. When we put essential oils on topically with the carrier oil, you have the option of relieving pain in some local areas. Sometimes it can help with wound healing. You have the option of having oils like cinnamon and eucalyptus and rosemary and clove that viruses have a tough time living in the presence of. So there are just so many healing properties to essential oils and CBD for that matter that I think should be taken, there should be a closer look taken, because there can be complementary therapies that can really help your patients to have a better quality of life, to be calm during procedures, to decrease anxiety. I don't know if you're a dentist or different things like that. There are just so many ways for you to use plant-based oils and plant-based options to really move forward with the treatment of your patients. So the Asian Pacific Journal of Tropical Biomedicine puts it like this: once the oils are in our system, they remodulate themselves and work at the site of malfunction. They go to the site where they're needed. So oils are smart in that way. And this type of remodulation and the permutation that happens can relieve patients from numerous ailments like indigestion, depression, headache, muscular pain, respiratory problems. I mean, inhaling eucalyptus or peppermint or what have you, and just allowing it to kind of open up the lung passages. Amazing, amazing opportunity for you to use complementary therapy. And what's important here, and what I'm glad that they mentioned, is that essential oils and CBD for that matter are found to be more beneficial when you're considering other aspects of life. Make sure that the quality of life is good. The diet is given consideration. You can't have a plant-based option come in and have to get around fried food and expect it to work immediately. Fried food, excessive alcohol, excessive smoking, these types of things. You want to make sure that diet is given consideration when you're introducing something that is going to help your body. So I like to mention this chart because it's important to know that there are different chemical constituents of essential oils, and they have different properties that allow them to help to heal or help to provide relief in certain areas that patients are dealing with. So if you're talking about, for instance, aldehyde, that chemical constituent has the property of being a sedative, an anti-inflammatory, antiviral. And some of the oils that fall into that category are lemongrass or citronella or melissa. So everywhere that you see these kind of chemical constituent categories, you can look on the other side and see the essential oils that kind of complement that use. So if you need a copy of this to be able to look over in your quiet moments or have a conversation with me afterward, I'll be more than happy to provide it. But it's just interesting to see how all of these essential oil chemical constituents have all of these properties, all of these good effects that some of our prescription medications that can cause more harm still have. So good alternative, good thing to look into if that's something that your patients are able to take advantage of. So just a couple of essential oil safety considerations. I'm always going to tell patients, whoever I'm talking to about essential oils, to always talk with your doctor. So our healthcare professionals on the line, I expect patients to come and talk to you about CBD. I expect patients to come and talk to you about holistic options for healing. I expect them to come and talk about essential oils. And they should always have that conversation with you, whether they have serious medical conditions or whether they're coming to you for a checkup. I'm always going to recommend that. Not applying to open wounds. We know that essential oils are very powerful, volatile molecules, and sometimes they can cause some irritation on skin, especially open wounds. So you want to make sure you apply it with a carrier oil, or if you've never used it before, patch test a small area. Just like you would do with any type of cream or lotion or new thing that you're using, patch test a small area to see how it works with the body. Keep away from the eyes, and if it does get in the eyes, making sure that you cover that area with a carrier oil as opposed to cold water, because what do we know? Water and oil don't mix. So that's not going to allow you to get that relief that you're looking for if you're trying to get oil out of your eye. We talked about the spacing of medications between CBD. We talked about the spacing of medications with essential oils, especially there are some essential oils that can be taken orally. So you always want to kind of keep that spacing. If you're not sure and you haven't been able to get in contact with an aromatherapist, you want to make sure that you keep that space out if you're going to be recommending holistic options, especially essential oils or CBD. More is not better. As I mentioned, these are volatile molecules that can cross the blood-brain barrier and really affect change really quickly. So you don't need a lot in order to affect change in patients, particularly when it's in the diffuser. 2 or 3 drops. And even some people start with 1 drop, depending on how sensitive they are to smells, because we know how powerful the olfactory system is in terms of getting into our limbic system, affecting our emotions. And we don't want to overwhelm our senses. So start low, similar to CBD. Start low, go slow, and increase as needed. If you have any questions about essential oils, I'd be glad to talk to you about them until I'm blue in the face. But I'm just really excited that we got the opportunity to talk to our healthcare professionals this evening about holistic organic options for helping your patients, because I think that it's very, very important to be open to that. So Dr. Rita, I'll give it back to you.
Thank you so much, Dr. Joy. Outstanding. I do know that you have a guest on the line. There are other guests on the line. We want to open up the chat box to take a couple of questions before we get ready for our 8 o'clock overview. So if you're on the line and you're a guest, please put in the chat box a question that you may have. We will invite you to get a further overview on our products, a deeper dive into our business opportunity at 8 o'clock. So if there are any guests that have questions, you can use that chat box for those questions. We want to thank Dr. Joy Smith. You do an amazing job all the time breaking down, that pathway, because so many healthcare providers need to understand how CBD is metabolized, drug-drug interactions, and then of course, using other botanicals. Maybe you have that patient that is still a little leery about using CBD, where there are essential oils that have healing properties as well. So thank you for all of that great information, Dr. Joy Smith. So you see Lisa's comment.
Lisa, whoever invited you, that will be the person that you get back with. And you do not need to be a healthcare professional. We just thought it important to have a call where we really break down the science to our healthcare professionals, because that's what our healthcare professionals want to see. They want to see the science, the statistics, the information behind why this is important for their patients. So Lisa, whoever invited you to the call, if they are a business partner, they can get you squared away. What's a good carrier oil to use? So at this stage now, whatever carrier oil I have is what I use, but MCT coconut oil is a great one, because coconut oil has a lot of medicinal properties itself. Almond oil, grapeseed oil. You can use olive. I don't particularly use olive because I feel like it has its own smell. And so it's not harmful from a health standpoint, but I feel like it has its own smell and I won't be able to really appreciate the smell of the essential oil that's added. But those are some options. And I would just suggest that no matter where you get your carrier oils from, your essential oils from, your CBD, you make sure that it has quality standards that it follows, because you don't want to be using a carrier oil, a CBD oil, or an essential oil that has not been tested, that has not been backed by a reputable company, or that has fillers or other additives that are going to be unhealthy for you. So yes.
Thank you for that. Any other questions? I think that's it. I think someone is asking if there's a recording, and we can get a recording to you, we can get a recording. Vivian Reed. Vivian Reed, are you a business partner or a guest? Let us know that. And I think that's all the questions. So if you're on the line and you want to obtain more information about our business, our products, please just contact the person that invited you, and they will absolutely get you the Zoom link. They'll get you the password for our 8 o'clock call. Dr. Sylvester, how are you? thank you for joining. One of our other Wakana Advisory Board members, Dr. Sylvester, is out in Seattle.
Wow.
I apologize for being late. I just got done with a client.
Wonderful. So you're a clinical psychologist, correct?
Yes, therapist.
Yeah,
I'm a therapist.
you're a therapist. You just
Yes.
want to close us out and just let us know how excited you are as it relates to using CBD with your clients and your family members and yourself.
I am very excited, as a matter of fact, and especially with the new products. I mean, I'm on cloud nine. I love the, I can't keep enough of the oud oil. Go naked. My people love it. And I was sharing just recently that I have quite a few folks that use the, and I don't know if you guys have covered that, but the cream, the mango cream, I have folks that use that on their body, and I have some construction workers that use that for pain, and they absolutely love it. They use that and the gummies, and they just love it. So my testimony is that these products are wonderful. I have started to keep kind of like a diary of the products that I use, because I know how important it is to keep CBD in your system all the time so that you can have that balance. So it's really important to me to make sure that I have it in my water solubles and everything, even on my food. I season with it. I do everything with it. And so I'm just excited. I don't want to take too much time, but I can go on and on. My testimonies are endless.
Well, thank you so much, Dr. Sylvester. And I know that you understand how important it is for healthcare providers to really understand
Yes.
the science, to really understand how they can really help their patients have an option for their health. So thank you for joining. And we look forward to hearing more and more from you, Dr. Sylvester. Well, we're going to close it out now, and we're going to get ready for our 8 o'clock product and business overview. Again, if you want to hear more about our specific products and our opportunity, you want to tune in to 8 o'clock. You can get that Zoom link and password from the person that invited you. So thank you all. We'll see you next Tuesday. Next Tuesday, please invite now those healthcare professionals, because they really need to hear this information. So good night, and we'll see you in about 10 to 15 minutes.
Night, everyone.
Good night.